All right, so now we're gonna go ahead and do feeding a patient. What you need for this skill, you obviously need a tray with the patient's name on it, and then you also need a bib or some sort of a clothing protector. Okay, knock, knock, knock. Come in. Hi, my name is Jenny. I'm gonna be your CNA today. I'm gonna wash my hands. I'm gonna provide you with some privacy. Can I have your name and date of birth, please? All right, Kate Hudson, May 16th, 2010. Sounds good. Okay, today we're gonna go ahead and we are gonna feed you some breakfast. So before we get started, I'm gonna go ahead and sit you up. We wanna make sure that you don't choke at all. Now remember, this is the critical skill, okay? The patient has to be sitting. The skill says between 75 and 90 degrees, but really just put the patient as high as the bed will allow them to go. Very good. Make sure you're nice and comfortable. All right, I'm gonna put a clothing protector on you, some sort of a bib, just to make sure that we don't have to change your gown when we're done. And before we get started, let me go ahead and wash your hands for you as well. Now, side note, you can use a hand wipe. You can also use a washcloth that you have warmed. Doesn't really matter as long as you get their hands clean. Okay. And my poor Miss Hudson unfortunately doesn't have another hand, so I'm just gonna wash one. You're doing well, honey. Okay, throw that away. All right, so I'm gonna go ahead and get this situated. Okay, Miss Hudson, is it okay if I sit on your bed? All right, thank you so much. All right, side note, the skill says that the tray has to be positioned in a way in which the patient can see the tray, okay? But obviously I need to be facing the patient. So this is the way you need to set up your tray. You need to have it situated where the tray is in front of the patient and you are behind them facing them, all right? Before you get started, you have to tell your patient everything that's on their tray. Ask them what they would like first, and don't forget to ask them about a drink at some point during the thing. Oh, the other thing I forgot to do, my fault here. Before we even put the tray down, we need to check and make sure that the patient's name is what the patient speaks, and also what is on their name band, okay? So, all right, can you tell me your name again one more time, please? Kate Hudson, very good. So I'm verifying that what she's saying and what is on her armband and what is on this is all the same information. Okay, very good. All right, so Miss Hudson, today we have Fruit Loops, we have some peaches for you, and we also have some Capri Sun. Is there anything you would like to eat first? All right, here's some Fruit Loops for you. Get a bite of that. All right, would you like some peaches now? Very good. Give you a bite of that. And would you like more Fruit Loops? Okay, great. What would you like next? Fruit Loops it is. Sounds good. How about something to drink? All right. Very good. What else would you like? Are you all done? You sure? All right, very good. Let me go ahead and wash your mouth and wash your hands up for you. Job. Wash your hands. Feel good and clean? All right, let me go ahead and take this for you then. Put your head down till you're comfortable. Very good. All right, I'll go ahead while I'm here, make sure your bed is low. It is. Before I finish my closing procedure, so again, couple quick things. You need to tell them what's on the tray. You need to ask them what they would like to eat first. Every time you give them a bite, make sure you tell them what you're giving them. Ask them if they're ready for another bite. Patients do not need to be rushed. That's a choking hazard. And then make sure you offer them something to drink, okay? This is a very verbal skill, and it's kind of hard to do with the mannequin because obviously she can't talk back to me, but you need to have really good communication when you're doing this skill. All right, closing procedures. Okay, very good. So I see that you have your call light here. Let me get your water and your tissues for you. Move this out of the way. Okay. There you go. All right, I see that your bed is low. It's locked. Both of your side rails are up. I'm going to address your privacy. Would you like your curtains open or closed? All right, I'll leave them closed for you. That sounds great. I'm going to go ahead. I'm going to take your tray. I'm going to take your bib, and call me if you need me at all. I would take this to the dirty utility area, so we'll pretend that that is here. This would go into my hamper, and then I would wash my hands.